Welcome to the AI Research Roundup. I'm Alex, and today we're looking at a paper trending on X, published on July 21st, 2025, just a couple of days ago. This paper introduces a conversational AI that, when overseen by a physician, achieved a top 1 diagnostic accuracy of 81.7%, compared to just 53.3% for human clinicians under the same rules. The paper is titled Towards Physician-Centered Oversight of Conversational Diagnostic AI, and it proposes a new framework that could really change how we think about AI in medicine. The authors tackle the challenge of using powerful diagnostic AI safely by creating a system where the AI gathers information, but a human doctor always makes the final call. Alright, so the first figure really lays out how this whole system works. The AI, which they call guardrailed AMIE or GAMIE, first talks to the patient. Now, guardrailed is key. It means the AI is specifically blocked from giving any actual medical advice. Instead, it creates a summary for a human doctor in a standard format called a subjective, objective, assessment, and plan note, basically a structured report of the visit. The doctor reviews this note later, which is what they call asynchronous oversight. The results chart then shows that GAMIE consistently outperformed human clinicians on key metrics like diagnostic accuracy and empathy. Building on that idea of oversight, this next figure shows us the clinician cockpit. This is the special interface the overseeing primary care physician, or OPCP, uses to review the case. On the left, the overseeing primary care physician can see the full transcript of the AI's chat with the patient. In the middle is that structured SOAP note we talked about, and on the right, the AI proposes a message to send back to the patient. The doctor can edit almost everything, and then makes the final call, either sending the message or requesting a follow-up. So, to really test this whole system, the researchers set up a rigorous experiment. This diagram shows their study design, which is based on an objective structured clinical examination, or OSCE. An OSCE is a common way to test clinical skills, using actors who simulate being patients. In the first step, these patient actors consulted with either the AI or human clinicians. Then, an experienced doctor reviewed the case using that clinician cockpit. Finally, a separate group of independent evaluators judged the entire encounter, from the initial intake to the final decision. Alright, moving to the results from that study. These charts compare the AI, GAMIE, against two groups of human clinicians. One group was early career primary care physicians, or GPCPs, and the other was nurse practitioners and physician assistants, or GNPPAs. The first chart on intake quality is really striking. The I was much better at following the main rule, not giving any medical advice. It also did a better job of asking about critical warning signs. Then, the notes it generated for the doctor were rated significantly higher on readability and accuracy. Okay, so we've seen the AI is better at the initial intake. This next set of charts looks at the composite diagnostic quality, which is how good the final outcome is after the doctor's review. The AI's proposed differential diagnosis, that's the list of possible conditions causing the symptoms, was rated much higher than the human clinicians. In fact, its top 1 diagnostic accuracy was 81.7%, compared to just 53.3% for the early career physicians. The overall quality of the final decision, combining the AI's work and the doctor's oversight, was also significantly better. Beyond just diagnostic accuracy, the study also explored the patient experience. The first chart here shows ratings from the patient actors, using standard evaluation tools like PACES and GMCPQ, which are basically structured rubrics for rating how well a clinical consultation went. It's clear that patients consistently preferred interacting with the AI. They rated it much more favorably on things like showing empathy and appearing trustworthy. The second chart then analyzes the edits doctors made. While adding escalations was common for everyone, doctors more frequently edited the AI's notes to make them less wordy. So to wrap things up, this research really demonstrates that a model of asynchronous oversight is not only feasible, but highly effective. By using a guardrailed AI for the initial patient conversation, the system achieved higher diagnostic accuracy and better intake quality than human clinicians, all while ensuring a doctor makes the final, accountable decision. It's a powerful new way to safely integrate advanced AI into clinical workflows, improving both efficiency and patient care. That's all for this week's AI Research Roundup. Thanks for tuning in.